Good evening, everyone. Here's something you probably don't want to talk about: STDs. But the increase in sexually transmitted diseases is so high here, we have to talk about it. The increase is so alarming, the CDC reports STDs are at an all-time high across the country. News West 9's Sammy Steele caught up with a local doctor to find out why more cases are showing up and how they're trying to solve the problem here.
Crystal, the Lone Star State isn't alone in the STD problem. In 2018, there were a total of 2.4 million infections throughout the U.S. that were diagnosed and reported to the CDC. While that number may seem huge, it should actually be much bigger. And that's because millions of cases don't get reported.
The CDC rates and the statistical rates are the reported cases, okay? So that's who goes to the doctor, who gets screened and is positive. And the reality is women go to the doctor more frequently than men, okay? A lot of men go to the doctor only at point of death.
Whether or not you have two X chromosomes or a Y and an X chromosome, STDs affect men and women just the same. And in the basin, the number of cases is on the rise, particularly for those between 15 and 25 years old.
The population has basically been booming. There's been a large population increase, okay? And with that population increase, we'll have more, not problems, but more diseases that kind of come to light and that.
In addition to the population boom, the CDC says there's other reasons West Texas is seeing more STD cases. There's been an increase in poverty, an increase in drug use, decrease in condom use, and dating in the digital age.
The things that has been new in the last about decade or so has been people meeting anonymous sex partners over the internet. There's so many dating apps and other areas to meet an anonymous person across the internet that has increased.
Dr. Peter says finding the solution to the STD problem doesn't start with any particular type of medicine or contraceptive. It starts with a conversation.
I think it's important for adults to have, or parents to have, open conversations with their teenage children about the risks that are out there and about sexually transmitted infections, and to make sure that they make responsible choices.
And if you think you do have an STD, the sooner you get to the doctor, the better.
So I think it's important that if you think you have a problem, it's better to go earlier when you think you're having a problem, and to not be worried about a stigma, or sometimes you have to swallow your pride and go in to the doctor's office.
Dr. Peter doesn't want money to be a factor in whether or not people get treated or screened for STDs. There are affordable options out there. Midland Health Department offers HIV and STD testing for $10 each. Treatment costs $10 as well. Ector County Health Department STD testing costs $20, but due to not having enough nurses on staff, they are not able to provide the services at this time. Crystal.
For more information on those CDC reports and where there are STD screenings in the basin, just visit newswest9.com or the News West 9 app.